Good morning, everybody, and welcome to today's webinar with Chris Johnston talking about resilience during COVID-19. Before I hand over to Chris, what I would like to do is bring up a quick PowerPoint presentation. So you should all be able to see my screen at the moment. So today's webinar, of course, is supporting resilience in clients and ourselves during COVID-19, and I'll be handing over to Chris in a moment. What I just want to remind people is that this is part of our Breakfast Bite series. Every Wednesday morning for between 20 to 40 minutes, we are doing very different topical discussions from everything around self-care, motivational interviewing, problem solving, into talking about youth homelessness, child sexual abuse, domestic violence, trauma-informed care, a range of topics. And you can see there our timeline. It should be on your screen. And so all of the previous webinars are available to watch back in the archives on our website. And you can see that in the coming weeks, we have upcoming webinars around eating disorders and self-harm, and we'll be adding more to our list for the second half of June as well in the coming days. After this webinar, you will receive a link where you can watch back these webinars. You can also register for the upcoming webinars. You will also get a recording of today's webinar along with Chris's presentation, and we'll also be signposting you to any resources he mentioned. So please don't be under pressure to take absolutely everything down. We will have resources available afterwards. I just want to flag with people who might be joining the call today that Fianza has changed our membership structures in the last 12 months. Previously, to be a member of Fianza, you had to be a homeless service operating at a national level. That, of course, is changing. It's part of Fianza's broader approach to preventing and ending homelessness in Europe. We can't do it ourselves as just homeless services. We need the input of foundations, of think tanks, of policymakers at local, regional, national level, of agencies, etc. So please, if you aren't currently a member of Fianza, you might want to consider your organization joining. Obviously, there's lots you can do to feed into our policy development, our thematic cluster work, our international practices, and of course, when COVID-19 is over, there's always the opportunity for more in-person networking opportunities and transnational learning across Europe to see what works well in different European countries. And so with that, I'm going to hand over to Chris. And as a quick reminder, before we get started, you as participants should be able to see a right-hand box, our box on the right-hand side of your screen, and there you can ask questions. There's a chat box and a questions box. Feel free to put in questions as we go through the presentation if there's anything perhaps that is unclear, that you might want more information on. And afterwards, we will also be able to bring the different questions together and have a conversation with Chris. So please feel free to put your thoughts into the box. And with that, Chris, I'm happy to hand over to you. I can see you're getting your PowerPoint up.
Thank you. Just almost there. That's the one. Here we go. So thank you, Robbie. So I'm very pleased to be with you. And I'm Chris Johnston. I'm a resilience trainer at an online college called collegeofwellbeing.com. I wrote a book called 7 Ways to Build Resilience. And just really to start, I'd love to just share a question with you, really, that I'd like you to think about examples of times where either you or someone you know, someone you've worked with, someone you've heard of or read about or seen on a film, was facing a difficult situation, and the way they responded to that situation led to a better than expected outcome. So I'm just thinking of what examples of that storyline, and I'm using that phrase storyline very intentionally, because that's really what this webinar is wanting to support, is how we can express and also support stories of resilience when we're facing challenging situations, or when people we're supporting, including homeless people we're supporting, but it could also be colleagues or family members or friends that we're supporting, are facing difficult situations. So just asking you to think about what examples of that storyline can you think of, and invite you just to write them in the chat window. And Robbie, just while people are writing, and I'm going to ask you, I don't know if you've got any examples that come to mind when you're thinking of um, situations that started out perhaps, seeming gloomy or bleak, but then worked out much better than you'd expected, linked to things that people did. Any examples you can think of, Robbie?
I'm sure there's plenty. Yeah, I think I can think of a few actually around COVID-19. I think for a lot of people, when we think about what an impact that's had on how we work and the people we work with, and I think it throws into question what are some of the functions that we do, and particularly ones that are no longer relevant. So for me, I usually organize an annual conference, and that obviously has been thrown up in the air because of COVID-19. So I can think of that springs to mind at the moment as a big obstacle I've encountered.
Yes. Yeah, thank you. And what I'm aware of is that this is a story we're still in the middle of, and there's a lot of uncertainty and perhaps also a lot of fears about when you have a beginning of a story. Because of this, you can get a sense of because of this, therefore that, because we have this virus pandemic, what we can have our fears brought up by that, but also one of the kind of ideas of resilience is look for silver linings, look for ways that it can work out better than expected. And in terms of examples of resilience, what we're looking at with resilience is, and the central question of this webinar is really around what helps you or the homeless people you're supporting face difficult situations and respond in ways that make better outcomes more likely. And when I train people in resilience, I begin by looking for examples of resilience because they give a reference point. And if we can have in our mind that reference point when we're facing a difficult situation or when the people we're supporting are facing a difficult situation, it can just give us a sense of, okay, well, maybe if they can do that there, we can do this here. And part of my work as a resilience trainer, I interview people who've been in the most extraordinary range of difficult situations, people who've been kidnapped, people who support people through earthquakes, and people who've lost people close to them. But also my background, I worked in mental health for many years in a addictions treatment unit, and also worked with people who were homeless, people with severe alcohol dependence. And in my work there, I can think of, as I'm sure many of you can too, service users who um, found their way into recovery and found their way. There may be people who were homeless who then become supporters of people who are homeless. And when we have that storyline in our attention, um, really what resilience training, supporting resilience, nourishing resilience is about is saying, how do we help that happen more often? And so that's my work. And I think one of the things that helps us is where we have an open mind, where when we're facing a difficulty, either in ourselves or others, we're open to the possibility that it can go many different ways. And in the Penn Resilience Program, that's developed by a team of psychologists at the University of Pennsylvania, they have a perspective check where they ask three questions. Whatever you're facing, they say, what's the best that can happen here? What's the worst that can happen here? And what's most likely to happen here? And already what that does is it breaks you out of a kind of a stuck thinking track, if that ever happens for you or others, where you can get very focused on the worst that can happen. And this is really, it's not so much positive thinking, but flexible thinking, thinking flexibly. And a colleague of mine uses her hand like this to say, what's the best that can happen? That's what you put your thumb up to. What's the worst that can happen? But also what's most likely? And resilience is then saying, how do we make the best or better outcomes more likely? How do we make the worst or less attractive outcomes less likely? And I think of that in terms of an image I use is this spider. I call it the spider diagram of radical uncertainty. And it's a stance of possibility where whatever you face, you're just open to the possibility that it can go different ways. And resilience is really about what helps us when we find ourselves, or the people we're working with find themselves on one of the worst legs of the spider. And it's recognizing that even from here, it can go many different ways. So when things take a turning for the worse, resilience is what helps us respond to that moment, or helps other people respond to that moment in a way that makes better outcomes more likely. And we can apply that to ourselves. So one of the challenges we face working alongside other people is the risk of burnout. But also in this challenging time of the virus pandemic, the worst possibilities include getting infected. And even if we do get infected, there's still different ways that that can go. And resilience is saying, well, how do I make recovery more likely? How do I make the better outcomes more likely? And so this is really about a story. It's a story, and I think broadly in terms of a two-part story. I work with storyboarding structures, and the simplest is this two-part story of here's me facing and what helps is. And if I'm alongside somebody, I want to find out what is it they're facing, and then alongside them, exploring with them what helps them. And this is, I'm sure, what you do. It's your bread and butter when you're alongside homeless people. You start from a basis of wanting to understand, build empathy, rapport, trying to develop an understanding of what they're facing, and then exploring what helps is. But also, there's a danger of being too client-centered in that we might have less attention for our own needs. And so um, I think in applying this a kind of dual benefit, both for helping others, but also helping ourselves, just to reflect, saying, what is it I'm facing? And naming the challenges we face, then saying, well, okay, what helps here is. And this storyboarding is really about a structure where you have you can customize it to many situations. I use this idea of sentence starters where you have a beginning of a sentence and you see what naturally follows it. So here's me facing this. That's something I often say to myself. It's like when I'm in a difficult situation, say, here's me, here's me facing this, whatever it is. When you're helping someone else, here's you facing this. Tell me about it. Help me understand what you're facing. And then together we'll look at what helps. And in terms of what helps, this idea of bounce ability, what helps us or others bounce in situations. And resilience is often thought of bouncing back. That's one way it can go. If you get a virus infection, you'll want to bounce back to your former state of health as quickly as you can. And it's worth looking at things that help that happen. If somebody gets depression, they have a depressive dip, what helps them get back on their feet? But that's not the only way that resilience can go. That I'm sure working alongside people who are homeless, you might be impressed by how they adapt to the situation, or what I think of as adaptive resilience. And the image I have for this is like a cork floating. There's something about buoyancy that a cork will bounce with the waves, it will rise and fall with the waves rather than being sunk by them. That there's times where we can bounce along with situations, we can adapt to difficulty. And probably you might find that, say, in times of lockdown that many of us experiencing in different parts of the world, that initially that was difficult, but you've adjusted to it in a way where you are bouncing with, adapting to a new normal. What you'll also be aware of, I'm sure, are times where people have been through difficult times and have been changed or transformed by them. And I like this idea of a transformative dip. The concept of post-traumatic growth, where we go through a difficult time and we're changed by it in a way where we perhaps find new strengths or learn new skills or develop new capacities or build new relationships or deeper relationships, improve relationships. And I think it's an important storyline to be aware of, that just because things are difficult doesn't mean that the second part of the story will always be worse, that there are ways in which we can be changed positively by difficult experiences. And I think this image of the butterfly going through its kind of cocooned time as a pupa is a great image for this time of lockdown, that there might be times where we retreat from as much contact, but we're also positively changed by that. And then a fourth image of a different type of resilience is particularly how we can allow learnings when we're learning about resilience, how we can play a role in transmitting that, perhaps even be contagious in resilience when we learn skills that we pass outward. So I'm wanting to really emphasize here that resilience is much more than bouncing back. There's different ways the story of resilience can go. And a great question that I encourage people to ask is, whatever you're facing, is just the question, what would a story of resilience look like here? And as workers alongside other people with difficulty, this idea of ripples, how can we play a role in transmitting resilience, spreading resilience? And one of the ways we do that is by practicing it ourselves, really getting to know this story of resilience, becoming familiar with practices, but also in this extraordinary time that we're in. Resilience is perhaps there's never been a greater need for really learning about resilience. And I wonder, find helpful the idea that can crisis become a turning point? And perhaps if it is a turning point at the time, one of the ways it will be is this is a time for large scale upskilling in resilience capacity, where we really get interested in learning about resilience. That's very much my work, is looking at how I can support a cultural shift. And what I do is that I work a lot with images, and I'd love if there's just one thing you get from this webinar, perhaps it's this image here, because this is also a tool. It's a tool I work a lot with people and say, if well-being, things going well, is a bit like rowing along merrily, then in life, there's times where we crash into problems, and that might be, for example, mental health problems, anxiety, depression, but it could also be virus infection, it could also be conflict, it could be losing a job. That's a risk, a rock that many people are crashing into or at risk of crashing into at the moment. Financial challenges in a time of widespread economic depression. There's all kinds of rocks that we can crash into, and homelessness is also one. But even within homelessness, there are many rocks that your clients are more at risk of crashing into. And one important insight here is that our resilience levels is like the water level. We can help people crash, when they're crashing into rocks, but we can also work with people about their water level. And the water level is like their background level of resilience. And it's recognizing that resilience fluctuates. We get some days where we can cope well with a challenge. We get other days where even the smallest thing becomes a rock that we can crash into. And it's the same with our clients too. There might be some times where they deeply impress you with their resilience, where they seem to be able to float over situations that you can imagine many other people finding much more difficult. But there might be also times where their stress tolerance is at a much lower level, their water level depleted, and they're more likely to crash. And this is also important in the virus, our physical resilience to infection as well. And I use this as a tool because what I do with people is I explore with them, what are the times they're more likely to struggle? What are the times they tend to cope less well? And I'm going to ask you to think about that now. What are the times when my resilience is at a low ebb? What are the times where even a small thing I might have more difficulty with? But also the other side of this are, what are the upward arrows? I tend to cope better when. I tend to cope better when, and this image here in the top right hand corner, I don't know if you can see it there. Well, just think of the water level really, that what are the times, what are my upward arrows? And that image of the kind of umbrella is a kind of buffer. The more upward arrows we have, that gives us a degree of buoyancy that has a protective effect against the downward arrows. And um, if there's one tool you take away from this session, maybe it's the question, how's my water level doing? It's a question I ask myself when I'm struggling. Say, how's my water level doing, Chris? But also, what can I do that would nudge it up? When somebody has gone through a difficult time and they've coped well, I'm really interested in what's helped them do that. What are the upward arrows that they've drawn upon that have nudged upward the resilience levels? And I have a framework for looking at that. But it's also particularly important in this time right now, because we can apply this water level mapping to our risk of getting the virus and also recovering well from the virus. That they've done research where they've squirted measured amounts of cold and flu virus up people's nostrils, and then they've looked at some of the factors that have a upward arrow effect on their resistance to infection. And it's interesting, when people are sleeping well, when they're in nourishing relationships, when they have less stress, when they're exercising, when they're eating well, and have also higher levels of positive mood, even with the same amount of cold virus, the same amount of flu virus, they're less likely to get symptoms. And so this is just really a point of reference for ourselves, that perhaps this is a time where there's never been such great need to pay attention to the factors that nourish our well-being, the factors that nourish our resilience. And so what I teach is a framework getting people to think about the strategies they use, the strengths they draw upon, the resources they turn to, and the insights that guide them. And I think of this as the SSRI Resilience Toolkit, and I'm sure many of you are aware of those letters. SSRI are commonly associated with antidepressants, the selective serotonin reuptake inhibitors. But I use them here to really refer to this idea of our resilience toolkit. And this is something we can develop. It's something that we can grow. And that's really what my work is about helping people more consciously develop their resilience toolkit. And I'm sure it's the work that you do as well. If you, I'm really kind of beginning a conversation here because I'd love to pick up on some of the questions that you may have, but I'm wanting to introduce a framework that you can apply to many different situations. You can apply it yourselves in thinking about what helps you deal with, get through as best you can the challenge of the virus pandemic, but also stressful work you do. And then alongside helping others, whether they're service users or colleagues, how can we build supportive networks that strengthen and nourish our own resilience capacity, including sharing strategies, supporting each other's strengths, developing resources and letting people know about them, but also sharing the insights, the ideas that make a difference. And so this is, in terms of the work I do, often get kind of like templates like this that I explore with people. And I've got a lot of this material available for free. If you look at collegeofwellbeing.com, that's my website of the online college, I've got a free online resilience course. It's called Resilience Tools for Free in a Time of Coronavirus Crisis. But I also have more developed courses. I've got a 3-hour video-based course I sell for about £30. And I also have a more advanced resilience practitioner training for people who particularly support resilience in others. So collegeofwellbeing.com is what I point you to. I've had a bit of a gallop there, really just having a 20-minute overview of some resilience building frameworks, the kind of ways that I might work with people supporting resilience. But I'd love to pick up some of your questions, and particularly about applying this in the context of working with homeless people, but also supporting ourselves as practitioners. So if we think about how we together develop and talk about our resilience toolkit, I'm interested in what you're taking away just even from this last 20 minutes that you can apply and use, but also what questions you have. Robbie, I'm going to invite you in here. You might have some questions yourself, but you might also be seeing some questions or comments or reflections shared by the community of practitioners that are part of this call today.
Yeah, so if you have any questions, please put them into the box and I'll put them to Chris. We can get a discussion going if you want more information or you thought something was interesting, but I don't know, maybe you have clarification, or if there's something you are dealing with in your own context that you'd like some insight on, please put it into the chat box or into the questions box. I think to get things rolling, I've got two questions. One is, because we touched on it very lightly towards the end, was around the relationship between, I don't think you called it self-care, but we talked about all nourishment and how they impact and benefit our resilience. If you could maybe say a little bit more about the importance of that relationship, because it's something I think that we're talking more and more about more generally. And the second question I have is this idea of like, what is resilience? And it's interesting, you had this idea of bouncing back. I was listening to a podcast this morning that was actually dispelling this exact myth, that sometimes we say, being resilient means you go from A to B and back to A. And that's not really the case at all. That resilience is this much broader experience that you change, you grow, and you develop, and it doesn't necessarily mean you have to go back from whence you came. I think that actually is something that I think is really important to walk away with.
Yeah, so thank you, Robbie. So there's two questions. One I hear is about the relationship between self-care practices and resilience. And self-care practices I think of as upward arrows. And they're really important. And I think there's two sides here. One is what you do in an emergency situation. And I think of the phrase emotional first aid. I teach emotional first aid strategies. And some of them are more about attending to your state, but some of them are attending to the problem that you face. And I think those are two broad directions, sort of emotionally focused strategies and problem solving strategies. But also it's about what helps you draw upon your strengths. And one of the things is just recognizing your strengths. So I'm influenced a lot by positive psychology. I do a lot around strength building processes. But if you're working with someone else, just noticing and affirming their strengths is a way of supporting and building resilience capacity. And in terms of resources, it's kind of like one of the questions is, how do we learn about self-help practices? How do we find out about them? And so resources can include sources of information, can include inspiring websites and TED Talks and apps, but also can include learning resources as well. I include resources also the people around us. An important part of building resilience is about the supportive relationships that help our buoyancy. But it's also interesting the thing about insight. So one insight, picking up on the second question, is you describe it as a myth that resilience is bouncing back. I think it's not so much a myth, but I think it's one way resilience can go. And that's why I like this idea of these different images that bouncing back. There are times when you fall over, you pick yourself back up again, get back on your feet. And so sometimes there is a return to a previous state. So if you have a bad cold or a virus infection, you can return to where you are. But also this idea of transformative resilience or bouncing forward is another storyline, another way it can go. And I think it's helpful to have this kind of flexibility that often it's more than one thing. It's more than one thing. There are ways that you develop new capacities in a way that you're never the same. So perhaps you're right there that it is always bouncing forward, but sometimes you're bouncing forward in ways that you can be consciously aware of. You
Mm-hmm.
can have conscious growth, and you can make post-traumatic growth more likely by drawing out some of the lessons that you're learning. So, for example, when somebody's been through a difficult, so for example, weekend, you see them on a Monday and they're telling you about how they've been through such a difficult time. One of the things I do is I'd affirm positive steps. I'd say, well,
Mm-hmm.
hearing all of that weekend, I just want to say I'm impressed that you're here today. And I'm wondering, like, what helped you get through the weekend and come and tell me about it today. So that's a what's called an evocative question. I noticed you had a on your webinars motivational interviewing. That's another of my influences. But when you're drawing out information, you're helping build transformative resilience by drawing more conscious awareness
Mm-hmm.
to the strengths that people have used in a way that helps them use them more.
I
You
think
might have some more
maybe,
questions.
yeah, we have a few after coming in. I think maybe you've answered the first question there when you talk about evocative responses, but Una is asking, we have this concept of flexible thinking, which is really interesting. And although negative thought patterns have developed and they seem the norm, there is always another option. How do we encourage people that are homeless to change that thought pattern? Now, the evocative questions might be one of the examples.
Yes, and so another evocative question is, okay, well, that's one way of looking at things, and I wonder if there's any other ways of looking at that that you can think of. So I teach, as well as emotional first aid, the idea of psychological self-defense. And psychological self-defense is where you have a thinking track that does you in, and particularly it, people often recognize that the idea of kind of voices they hear inside their mind. And for example, I'm aware of a very self-critical voice that I hear sometimes, and I call it the crap channel. And the crap channel is like a radio program that blares away with a running commentary about what a mess I've made of things. And it's
Mm-hmm.
interesting here that research shows that critical, destructive self-criticism is a risk factor for depression after a difficult experience. And so if people have been through a difficult experience and they have a lot of self-blame and critical self-commentary about it, that is a risk factor for depression. And if people can recognize that, then say, well, how do you find another voice? So, okay, one voice might be this critical voice, and we'll give a name to that, and I use the term the crap channel, but I encourage people to explore their own language and naming. And just giving it a name is a way of creating a bit of distance to it. And then
Mm-hmm.
thinking like, well, if you had a good friend alongside you, what kind of thing might they say? And what we're doing here is this is self-talk, positive self-talk. And research shows, for example, that when you teach children the skill of speaking to themselves in encouraging ways, when they go into hospital, they suffer less from anxiety. And so this is a proven resilient strategy. So that's what I might do. I might say to somebody, if you had a good friend alongside you, what kind of thing might they say? And
Mm-hmm.
are there ways you can find that voice, find the encouraging voice rather than the crap channel when you're in a difficult situation?
Great, I think that's a wonderful answer. I have a comment, but from Julia in Poland. Say thank you very much for the presentation. It's just become my upward hour for the day, and hopefully later as well. I have to hurry up for a staff meeting, but we'll visit your resources. Have a great rest of the day, Julia. I think is always nice
Thank
to
you.
get kind of comments. So if
Yes.
anyone has any questions, please feel free to put them in.
Oh, so those are resources. What I'd point people to is the website collegeofwellbeing.com. And actually, I've got a number of free resources, as well as the free course on resilience. I'm doing a free course on motivational interviewing at the moment. That's another thing that I teach, and actually, I've got a free webinar this evening on that. But resilience building is my main work, and I think also this idea of the growth mindset, this idea that resilience isn't just something that you have, but it's linked to skills that you can learn
Mhm.
and insights that you can learn as well, that there's a learnable side of resilience. There's also a natural inbuilt side of resilience. You just need to look at a toddler learning to walk, and they fall down, they get up, they fall down, they get up. And we have that natural bounceability inside us, but it's not always as much as we'd like.
Has
And
to be
so,
cultivated.
yeah, exactly that. We can learn to cultivate it. We can learn to nourish it.
Okay.
And that's really what resilience building work is about.
And we'll share those resources as well in the follow-up email. I have another question. So how can we cope with that feeling that you cannot change things and you just feel useless?
Yeah,
When
that's
you have
such
that
an
mindset.
important that's such an important question. And what we're looking at here is the experience of powerlessness. And Martin Seligman, who's such a pioneer in positive psychology, he began his research career developing work on learned helplessness, the idea that when we're faced by a difficult situation and we believe that we can't do anything about it, that's a risk factor for depression. And he got very interested in the shift from focusing on the negative to focusing on the positive, saying, if you can learn helplessness, can you learn optimism? And so his research for a long time was about learned optimism. And this is also about shifting thinking track. And I would say it's a journey. It's a journey in shifting thinking track. And I think just to recognize that we can get stuck on a thinking track, but also this idea of developing choice points and developing awareness of choice points. So one choice point is what I focus my attention on. And for example, a lot of research on mindfulness. Mindfulness is really where we pay a lot of attention to paying a lot of attention to what we pay attention on and bringing our attention into the present moment. But it might also be a safe and neutral focus. So if our brain is getting tangled up in a thinking track saying, I can't do anything about this, I'm hopeless, and that whole kind of rumination around pointlessness and hopelessness, just to shift track to something safe and neutral like our breathing can just allow us to settle our state. And this is one of the routes into resilience. There's different routes into resilience, but this is the kind of emotional first aid. Because what's interesting here is the way we think is influenced by the state we're in. And that when we're caught up in an agitated or sunken state, our thinking changes. It's a bit like we put on a pair of dark glasses and everything seems a bit kind of murkier and less
Yeah.
light about. And so changing our physical state is one of the ways into changing our thinking. But also, there's a whole load of learnable skills about shifting thinking track. So this idea that I can't do anything, one antidote to that is just to ask people, yourself included, maybe do a piece of writing along the theme of a time I made a difference was. A time I made a difference was, and not like doesn't have to be anything particularly big, but there was a situation that changed as a result of something you did, maybe something you said to somebody, maybe the way you were, maybe something you did to help somebody. And we can probably all think of situations where we've had an influence on the context that we're in a way that we feel good about. And if you get people to think of those times and then think, what strengths did you use that helped you do that? You start shifting the narrative. And it's this thing about, is the glass half full or is it half empty? Um, we can focus a lot on the emptiness in a way that can leave us feeling hopeless, but we can also focus on even if there's a little bit of fullness down the bottom of the glass, how do we focus attention on that and then build up from there? My first book I wrote was called Find Your Power, and it was really about how we tackle powerlessness, because it's such an important frontier. I'm sure with the homeless, but also in my work for many years in addictions recovery, people used to feel like, I've got no control over this. It's completely, every time I try and give up drinking, whatever it is, I fail and can feel completely defeated. But it's also possible to turn that feeling of defeat around and build from the small and build up from there. Um, and it's really about building capacity, building the jargon term is self-efficacy, the kind of belief that we can make a difference, we can make a meaningful difference to the way the story of our life goes.
Thanks. We have one last question from Maeve. So, have you heard of the window of tolerance? And would you equate your resilience training and method to similar ideas of hyper and hypoarousal? A lot of things I personally don't understand in that, but I hope you do.
Yeah, and it's a shame. I use a slide around that, and I've got a whole section in my book, 7 Ways to Build Resilience. The second way is emotional first aid, and this idea of a window of tolerance, sometimes talked about as the resilient zone, that we have a natural charging up of our nervous system, the
Mhm,
sympathetic nervous system, a natural kind of wind down system, the parasympathetic nervous system, but either direction can go too far. We can get over aroused in a way where our brain changes. The very interesting research from brain scans showing that different parts of our brain are in charge when we're in states of agitated distress in a way that can leave us feeling less capable of dealing with situations, and that's the over arousal or hyper arousal. And so teaching people emotional self-regulation skills, ways of resourcing themselves, settling themselves, can help them widen their range of what they can cope with. And the other side of that is that people can get sunk by challenges and also in a freeze state, and freeze state where people feel stuck for words. They feel literally the term petrified, turned to stone. But there's also milder ways that can happen that are very disabling when we just feel like our brain turns to goo. And learning ways of bringing our attention back to the situation. There again, this is about emotional first aid. So I think this is a very important concept, this idea that there's a kind of a bandwidth of coping,
mhm.
but we can increase our bandwidth of coping through learning skills. And this is one of the areas where our understanding about how to build resilience has really grown over the last few decades.
Great. Well, thank you very much, Chris. That's it for the questions from the participants today. So I want to thank everybody for joining us, but a special thank you to Chris, who came on and gave us a really good presentation on resilience and how it can impact on our own work. I just see we've got one last question. Are you okay to take it?
Sure, very happy to.
Okay, I think it might be a follow-up because it's from this. It's also from the same person. So, also, what are your thoughts on the efforts of subconsciousness are making to the process of the COVID situation, and whether the fight or flight response and subsequent cortisol levels are responsible for the feelings of exhaustion that I hear so many people complain about at the minute, therefore
Yes,
making it harder to practice resilience. Whew.
yes. No, I think it's this thing about here's me facing. So here's me facing, I think just to acknowledge we're facing the most extraordinary situation. If someone said 6 months ago, there's going to be a time where it's actually illegal in many countries to walk down a street with a group of 3 friends, that we'll be shut in our homes, many of us, that we will, lots of people will lose their jobs. If you kind of describe what is now becoming the new normal, you might think, oh, that's a far-fetched science fiction story. And when we're facing shocking circumstances and traumatic events, it has a big effect on us on a bodily level. We have a hardwired threat detection and threat activation response system that pushes us into a different place. And I talk about zones. There's a green zone if I'm comfortable, orange zone, I'm stretched, and a red zone is like I'm over an edge. And a lot of people are in the red zone.
Mhm.
It's unevenly distributed. Some people are really pushed to edges, and other people are more comfortable and kind of perhaps cocooned in a safer environment. But it's having enormous impact on our whole collective psyche. And when people are in those edgy states, they can react different ways. One of the things, they can turn against each other. They can become more suspicious, more hostile. You can
Okay.
see personality changes. And that's why I think to have an understanding of resilience is even more important, that we're aware of how perception of threat can change our state, and changing our state can change the way we think and respond to
Mhm.
situations. But if we know that, we can also learn ways to inhabit more resourced and creative and constructive responses. And that's really what I think of it as active hope. It's like we identify what we hope for, and then we're active in making that more likely. And it's a whole body of work that our world really needs to give attention to just now. So I'm pleased to be talking with you, to a community of practitioners who
Mm.
you also see this as part of your work.
And I think on that note, we can wrap up the webinar. There was one last question that was just about the recording, and you will everybody get a recording after this webinar, along with Chris's presentation and signposting to the resources. So thank you very much, everybody, for joining us, and Chris, for giving us your time today. We really appreciate it, and I hope everyone has a lovely day.
Great. Bye.
Bye, everyone.